Hey guys.
Hi, everybody. So we're having technical difficulties here. I just wanted to try something new, so I wanted to see how we're trying to do a couple of different things to see how it works. So I'm going to log on my phone here. That way, if you guys have any questions, I'll be able to see them there. And of course, I don't want to hear myself. So there we go. Perfect. All right. So if you guys see me looking down, it's because it's the only way I'll have to see what you guys are posting, because otherwise I'm going to be looking at myself the whole time and it's kind of distracting.
Yourself. You just can't stop looking at yourself.
Right? I mean, we're so critical of ourselves all the time. Well, I am anyway. So I'm super excited today. We get to talk about something that you've actually helped me with.
Yes, I have.
So this is exciting. I got to say, for those of you who don't know us, my name is Jamie Weiland. I get the pleasure of interrogating Dr. Colin Kinsales here from Integrative Health and Wellness. Every Wednesday, I have the opportunity to pick the doctor's brains here. It's one of the benefits of being the front desk girl is I get a plethora of natural health information every day.
You hear it day in and day out pretty much.
Sometimes I don't know how either one of them get anything done because I'm constantly asking them questions.
A lot of brain picking.
And you would think by now, I mean, I've been here almost a year working here.
Mm-hmm.
You'd think I'd be done asking you questions.
Well, we're always learning new things too. So it just keeps feeding the fire.
They say the best way to learn is to teach. So I'm just helping you out.
That's actually one of my favorite things to do is teach. So.
All right. So it's super cool for you guys too that he feels this way, because every Wednesday they share this knowledge with you. I just get to be the guinea pig that asks them your questions. So if you guys have any topics that you would like the doctors to address, or you have questions that maybe we don't get to go over today, just send them to us and we'll do our best to get those answers out to you.
Absolutely.
So you can always visit our website. It's ihwcenter.com. That's where you can send us a message, or you could just DM us right here on Facebook.
Yep.
So tonight we get to talk about back pain, which I gotta say, for any of you who don't know, I actually started coming here for a thyroid issue, and it was probably like about a year later that I was suffering with I was diagnosed with a herniated and bulging disc with stenosis. So I had gone to a ton of different doctors. I actually went and did like there's like a stretchy thing some chiropractors will put you on.
Traction device. Yep.
Loved that traction device.
Yep.
3 days a week for like 40 minutes I would do that. It was so amazing until like I went back together, and then I was like, oh my gosh, I'm in so much pain again.
Yeah.
It was awful. But like I remember a time when it was not last summer but the summer before that, and you didn't even know this. Like I was coming to you, I remember, and I don't remember like talking to you about this because I was really just coming to you at that time for like my thyroid, you know?
Yep.
And it was just kind of maintaining that. And a lot of times I feel like this is what happens to some of our patients here, is that they don't realize how much you can help them with.
A lot of other things, yeah.
So it's like
almost everything.
And we just neglect because we don't think about it.
Yep.
And so much times I feel like we just get used to how we are. Like when you're sick, your body adapts to that.
Yes.
And you just accept that this is just how it's going to be.
Yeah, a lot of times it's a slower progression into feeling ill or not as well as you should. So until you bounce out of that and kind of take your health to a new level, you don't realize how crappy you are feeling to begin with.
It's so true. And so many people since I'm up at the front desk will say, I didn't realize how bad I felt until I started feeling good here.
Yeah.
You know? So 2 summers ago, I spent the majority of the summer laying on my bed, and not because I was sleeping. I was over that, right? Like I got over a thyroid issue where I couldn't get out of bed because I was sleeping all the time, to still being on my bed because anytime I would sit, the pressure of just sitting, the weight on my lower back, it just caused so much pain.
Yeah.
That I didn't want to go anywhere. I didn't want to walk anywhere. Amusement parks, we actually had a pass to like Idlewild Park, which is super close to where we're located.
Yep.
And I couldn't go because it hurt.
You missed out
so
on Idlewild.
bad all the time. it was like such a waste for the poor kids.
Yeah.
Because there's no way I would take them. It was awful. I would buy special shoes that were expensive, trying to overcompensate for the pain.
Mm-hmm.
And it's just so crazy. And I remember like thinking about neurologists. Is that what they call their neurologists?
Yeah.
And the one neurologist that everyone had recommended to me actually had quit. So I couldn't even find him. And like getting back surgery, like that's a big deal.
It's a huge deal. Yeah.
And so I was like, well, you know, I just wasn't comfortable with that. So I just kind of learned different ways to deal with, like live with back pain.
Mm-hmm.
But when I was coming to you, I didn't think that that was something I could discuss. Not that I couldn't discuss with you, but that I should.
Yeah, because you felt like you were only there for thyroid.
Right.
Yeah.
And we'd fixed that. So it was like, oh, okay, I'm still just coming for maintenance.
Yeah.
You know?
Mm-hmm.
And then I remember like shortly, like I started working here.
Mm-hmm.
And it was crazy because you like called me out on my little, you know, how do you call it? Like coping mechanisms, right? Yeah. So I would like do things. And it was stupid stuff too. It'd be like bending over to pick something up.
Uh-huh.
And there are times in my house I would grunt.
Yes.
All the time. Like it was like I would get down, and it's not that I couldn't get up, it just hurt so bad to go from being on the floor,
Mm-hmm.
like kneeling, to standing, that I would grunt just to give myself enough like oomph to push up.
Yep.
And then anytime, like I remember having this constant shooting pain down my right leg, and then my right foot would be numb all the time. Yeah. And I would go, we laugh because anytime I'm in pain, funny. I go, mm-hmm.
Yeah, it's like she was getting up to pick something up, and her grunt is, and then she goes, just to cover it up.
Mm-hmm. And then I came to you. It was like one day we were, you know, before work, and I asked you if you knew any good neurologists. Uh-huh. Like, I don't know a good neurologist here, so the one that everyone's recommending is done now, so I don't know where to go, what to do. Who do I go to? And you were so matter of fact, and you were like,
here.
Why don't I just fix you? You're like, I'll just fix you. And I remember looking at you like, okay, you're going to fix me.
This is a neurological condition.
There's no way you're fixing me. But I didn't think there was any way you were getting me off thyroid meds either. Mm-hmm. So at that point, I mean, I just felt like, what do I have to lose? You know? Yeah. I mean, I know, like, I had joined a pain management support group on Facebook. Mm-hmm. And, like, so many of those women had back surgery, and they were on there because they were still in pain. They were still having problems. And they're asking, like, how do you guys live like this? How do you raise your kids like this? How do you enjoy life like this? One lady I'll never forget, because she couldn't even date somebody because she was like, I'm expecting him to take care of me immediately, you know, because she was in so much pain and just restricted from back pain. I mean, it is so restricting.
It's very limiting. You can't live your life, really. It affects everything. You're sitting, you're in pain. You lay down, try to go to sleep. A lot of times you can be in pain. You can't move without pain.
And it's frustrating.
Like everything. Oh, yeah. And then you just get totally irritated. Like what happens whenever you slam your finger in the door? You just get really angry and mad, and you shake it. And then any little trigger that irritates you, you just snap. So being like that constantly in pain, I mean, what are your relationships going to be like? It's going to be miserable. Everything in life is going to turn out to be terrible because of how you're interacting with the world due to the pain that you're experiencing.
It is so true. And whenever I started coming to you for those adjustments, I did not come in here and it was all fixed into 2 treatments.
No, you had a good condition going.
I did have a good condition, and there were times even I remember coming in and you'll ask me, you know, certain times of like, okay, so does that feel better? You know, and a lot of times I'd tell you it doesn't yet, because I would leave here after a treatment and like I wouldn't feel better till the next day.
Yep.
Like my body somehow
just
needed
readjust, and a lot of times if you have inflammation that's been going on there for the previous, you know, week or whatever since I saw you the last time, when things start moving properly, everything slides the way it should, and the inflammation is pumped out. And the only way that that's pumped out is by moving the muscles a lot of times, or just drinking water and having that natural flushing action occur. It's pumping out the inflammation. So sometimes, a lot of times we're after immediate, I mean, we're always after immediate result. When you come in here, you want you feeling better before you leave. And that's my goal. And Dr. Sarah's goal is that's what we're aiming for. But sometimes inflammation builds up and it just takes a day or two to calm down and flush out. And inflammation is pain. So that's what's generating your pain.
So I want to encourage anybody who has any type of pain issues, even if it's not your back, I want to encourage you from the bottom of my heart, because, you know, it was like, I remember, you know how Facebook will give you these year updates? So I got this year update, and it was actually a video I had taken of myself at camp with my family and a couple other families, and I was so ecstatic, like I was crying because I was walking in the woods with all these people, and just the fact that I could hike with them was such a ridiculous blessing that I completely forgot, because now I've been well for a while.
Yeah.
I completely forgot how crippling it was, how much of my life I was not able to enjoy with my kids because of that pain. And then, you know, it was a few months later, and now like I play soccer with my kids and we play softball. Like I get to be the mom, like an active mom. Like I'm normally an active person.
Yeah.
So it's like so awesome that I before I saw you, I could count on one hand how many times I was not in pain in an entire week, because I was constantly in pain. That right leg was constantly in pain, and there were stores I couldn't go to because of the floors. You know, like those cement floors, like Lowe's or Home Depot, they're just cement.
Yeah.
Oh my word, it's just the most excruciating pain. I'd be crying
jarring.
2 minutes in there. Now I can go shopping all the time. Like I don't wear special shoes. I just
wear normal shoes now.
I just live normally, like, and I get to enjoy my life, which I just didn't think that was possible. So I just want to encourage any of you out there, if you're thinking about, you know, surgeries or things like that, just have hope that, you know, this might just be the best option for you. So it's one of the reasons I'm super passionate about talking to you guys about this today. So let me dive in to asking him your questions. And I don't have them. All right. I don't know. I wrote them out.
No.
Okay, so we're going on the fly. I totally wrote those.
You can go. Yeah.
Okay.
I don't know.
So.
Oh, here they are.
Hey, look at that. Perfect. All right. So let's talk about different pains first of all, because I did have a diagnosis, but pains come in different forms, right? Yes. Like I've had achy pain, I've had pain down my leg, I've had numbness. We all have the crooked pain.
Yep.
Like you see people walking goofy all the time, you know? So can you tell us why we would have different pains, or what different pains mean? Could mean.
So sometimes you can tell by the type of pain or how you're moving, you can tell where the back pain is actually stemming from. And for that, I don't mean, oh, it's in my back. I mean, what the actual cause of the back pain is. So if you have, maybe it's like you're stuck one way, like to the right, and if you move to the left, then you experience the pain. If you, like anytime you tilt one direction, you're in a lot of pain and you're just stuck one way. That a lot of times is a disc, because the disc will bulge out. So this is bulging out this side, you're going to be this way, and as soon as you move this way, you're compressing on that bulge in the disc and you generate pain. Discs are pretty interesting because they really truly only develop whenever you're about, like from your teenage years to about 25 years old. That's whenever you have a disc problem. After that, the discs actually begin to dehydrate, and the likelihood of you popping a disc is very, very low. So,
popping a disc?
Well, herniating a disc.
Okay, so I didn't even know that's what a herniated disc is.
Yeah, so a herniated disc, you have tight, they're called annular fibers. They're fibers on the outside of the disc, and inside you have like a jelly. So what happens is with a herniated disc is that jelly kind of protrudes through or bulges out of the fibers. So that's usually going to happen whenever there's more jelly there and it's not dehydrated.
Okay.
And that's when you're younger. So the back pains that develop in those years, if you have a herniated disc, that will usually cause a weakness throughout the rest of your life. But it can be stabilized and handled, so you don't have to suffer with it, even if you did have one earlier. When you're older and you've never had a disc issue or a low back pain issue until you're like 30 or older, then that's probably not going to be a disc. Truly, it's probably not going to be a disc issue. But a lot of times disc issues will happen from or poor protein digestion. So whenever you're not either eating proper amounts of amino acids from meat, or you're not breaking them down, you don't have proper amounts of stomach acid, or something's not just absorbing properly, the discs aren't going to be able to handle the stresses from daily life because that protein's needed to feed the disc, or the fibers, to keep it strong. So that could be a source of disc issues, and that's one of the things that we look for. If you have like a sciatic pain, so it's a pain traveling down the back of your leg all the way down to your feet and your toes, that can be more muscle, and there's a little muscle in your butt called your piriformis muscle, and it cuts across to your hip, like from your sacrum, which is a triangle at the bottom of your spine, to your hip. If that muscle's not working right, it can put pressure on that nerve, and that's when you experience the pain going down the leg.
Is that sciatica?
That's sciatica. A lot of times, though, we fix sciatic pain by actually correcting a muscle in the neck. It's really interesting. So we're looking for nerve irritation in easily accessible areas of the sciatic nerve. Would be like in the back of the knee or on the bottom of the foot. And if they're tender, and I have you turn your head to one side, say the left, and that pain goes away, I know it's being generated from the neck. So we fix a muscle in the neck that's involved with head turning, and then that sciatic nerve pain goes away. So you can have nerve irritation all the way from it, because it affects the spinal cord, because a vertebrae may be out. You fix that, and it actually eliminates the nerve irritation down the leg. And that could be foot pain, it could be a number of different things.
That's what you did for Lexus's plantar fasciitis.
Yes, that's the same way of correcting something like that.
Crazy. It's the most amazing thing.
It is very, very interesting. And then you have, like, say if you have digestive issues, and then you start developing, like, say, constipation, then you start getting back pain, it's actually coming from your digestive tract. Because if you have a buildup of toxins, you're not pooping the way you should poop, then you have toxins that will actually leach out of your intestinal tract and into your low back, and inflammation will ensue there, and then you'll get low back pain. Back pain that's better after moving, that's usually going to be toxin, like chemicals, or metal toxins, or the lymphatic system, garbage disposal system isn't flushing or draining. Whenever you start moving, you pump the toxins out. That's why you feel better. So those are like some examples of sources of low back pain. It's not always coming from your low back.
How about the shower?
What about it?
I love the shower story.
Oh, so you were worse after a shower?
Yeah, so I totally forgot about this, and somebody came in here with the same issue, and it was, I would get a hot shower, and the hot shower, I would just be in excruciating pain after a hot shower. Yeah. So thankfully I would get showers after bed so I could lay down.
Okay.
And so
with that, so whenever you heat a disc issue, you make it worse. So just as a general rule of thumb, if you have low back pain, you want to do ice. And how you apply ice is you get an ice pack, you get one paper towel, put the paper towel on your skin and put the ice pack right on it. And then you do 15 to 20 minutes of that, leaving it on there, and then take it off, and don't do any more than 20 minutes an hour. It should feel achy, burning, and then go numb. And when it's numb is when you're getting the benefit of the ice. But never do heat, especially with low back, because if you do it, and the neck too, sometimes, like if you have a stiff neck and it's not moving, it's probably an irritated disc. It's due to a vertebrae that slid forward on one side. That you don't want to heat either, because those things are just as nasty as low back pain. When you heat it, it may actually, for some people, it feels better for a little bit, but then it gets worse. So always, and after you shower, or like you can take a hot shower, but ice immediately after. You need to pump out that inflammation. It's
so funny you say that, because while I was heating, I would even lay on a heating pad because during the heat process,
feels good.
It was such relief. But after was
misery.
Awful. It was so awful. So I totally get that. Okay, so I want to know. I see you guys on there. I love you girls so much for joining us. I just want to say thank you, thank you. And so, like, somebody has any of these issues, right?
Mhm.
Does it matter what age they are? Like, I know a lot of times people are nervous about coming to a chiropractor
Yeah.
at different ages, and then, or have had, gone to a normal chiropractor, and got popped.
Yeah.
And so there's some fear there.
It's understandable. If you've ever been adjusted before in it and you felt worse afterwards, it's actually because you have something called adrenal fatigue, and the ligaments which hold your bones together are stretching when they're overstretching because they're already loose. And your adrenal glands produce hormones that hold it together. So after an adjustment, you'd feel worse. We make sure that you don't have adrenal fatigue before we would adjust. But it's interesting because right now, kind of the advancements that we're making in like clinically and other doctors that we're studying and learning from, we're getting to the point where adjustment is rarely needed now because we're fixing the wiring to the muscles surrounding the spine, and the spine's actually moving in place the way it wants to. And I know like some people love to be adjusted, it feels great. And certainly if it's needed, we'll do that. But I would rather you feeling great for the rest of your life than just that couple days or two after an adjustment's been performed. So yeah, there's no fear. We treat really old people, really, really young kids, babies just born, very gentle stuff. It's always ultimately working with the wiring and circuitry of your body to fix it up because that's what's controlling everything.
So this wasn't on our list, but as we're talking, it's just kind of coming up. I know there are some patients here who, like I, was a C-section.
Mm-hmm.
But there are patients who have come here that were C-sections that then, after coming here through their pregnancies, have had a normal birth. Yes.
Yeah. Yep.
And that is a positioning issue
That
too,
is.
right?
So like breached baby, sometimes that would be a reason for getting a C-section. Yeah, we make sure if everything's working properly. One thing is the heart. We make sure that's working properly if you're pregnant because the heart, for whatever reason, is needed. Women with hearts that are like weaker than they should be, they don't have the nutrients needed to function. For whatever reason, those pregnancies seem to last a very long time, and that increases the likelihood of a C-section being done. We want to make sure that the pelvic floor, so the bottom of the pelvis and the pelvis itself, is able to move properly and open up the way that it should to allow a baby to pass through. Which actually, interestingly, it brings me to another point. A lot of low back pain is associated not only with bowels and digestion, but a lot of those muscles are wired up to the reproductive system. So if you're having a reproductive issue in any way, shape, or form, it could be PCOS, it could be, just problems with your cycle. For males, it could be prostate stuff. But if you're having an issue with the reproductive system, it will affect the muscles that stabilize the low back and pelvis, and that would then lead to low back pain. Same thing with the kidney. A lot of those muscles are wired up to there. So those are things that we also check because that could be a source of low back pain as well.
So could you, I know that you helped me to not need surgery, okay? Mm-hmm. And there are times, I don't want to mislead anybody here, there are things that I know because of you that I need to do to maintain being pain-free.
Yeah.
There are certain things that are, and I would gladly share them with you on a personal level. The only reason I'm not going to share them with you on a live is only because it is a personalized thing. It's not that it's so personal I can't tell you.
Yeah.
There's not much I wouldn't tell you guys. Yeah, it's no secret. It's just that what I'm doing for me mm-hmm. could be totally different to what you might need to do, Yeah. So I don't want to say, but there are, I feel like you've given me information to like be responsible for myself.
Absolutely.
There are certain things that I'm like, okay, I'm totally going to do this, but I totally know it's going to cause me some pain.
You know the consequence.
I know there's a consequence coming. But I always think that the consequence is such a nice thorn in my side because it's what keeps me doing the right thing.
Yeah.
It really is. Otherwise, I think I'd be right back to my old habits, you
Mhm.
know? So it's good that for me personally that I have this thorn,
Yeah.
you know, that helps me.
There are some general things that you could try though. So, look at foods that are higher in vitamin E because that's going to actually help the reproductive system and all those muscles. So that's one thing that we check with people with chronic low back pain. So wheat germ oil is one, but I would stay away from it. You need a very specific kind that hasn't been exposed to oxygen because then it goes rancid and then that's just nasty. You have sunflower seeds and you can do almonds and avocados. Those are higher in vitamin E, so increasing those in your diet may help. You can do basic exercises just to kind of loosen things up and get things moving. One's called a cat camel. I'm not going to demonstrate it here on the
I
table
know
right
what the
now.
cat camel
Cat
is
camel, and that can help to just flush the nerves and help out pain a little bit. The icing would be helpful. Those are just some of the things you can try. But with something like what you had, stenosis is a cause too. So that's whenever the spine kind of closes in on the spinal cord, and that could be a bony stenosis. So the bones are actually increasing in, they're getting thicker around the spinal cord, or you have soft tissue too that's around there. So there are two causes of stenosis, and both of them can be helped. Bony takes a lot longer, but that's going to be, seeing what the cause of that inflammation is. I'm not sure why that popped into my mind, but that's just another, because you mentioned stenosis. But those are some things you can try. But we can certainly help you out with back pain. We have a lot of really good success with that.
What about everyone always goes right to the fish oil?
Yeah, fish oil is good for just inflammation overall. You want to be careful with the type of fish oil that you get. One, you want to make sure it's clean. We use Nordic Naturals, and you can find that in most stores. We have the Pro line, which is for professionals, but you have something that's called DHA and EPA in your fish oil. DHA is good for your heart, and it's more calming to the body, helps you sleep. EPA is better for the brain, and it's more of like a stimulant in a way. So if you're not sure what you need more of, you get a balanced one, and that helps with general inflammation. It's not going to heal up your low back pain though.
Okay. So just so you guys know, for any of you who have never been here before, one of the cool things is him and I are talking. One of the things you don't know about me, and the only reason I want to share it is because this is what happens. You come here and they figure out these little tweaks of like, oh, well, you have this could be a cause of this, okay?
Mm-hmm.
So before any of this, my back issues happened, I was vegan for about a year that I was vegan. And not that I'm not saying anything against vegans, but I wasn't a good vegan because I did not care.
You have to be a very excellent vegan to be able to do it.
And I paid no attention to how much protein. I was just more concerned with the fact that I wasn't eating meat. So I was like, oh, I can eat anything I want as long as I'm not eating meat.
Yeah.
But I was not paying attention to the protein intake. So it's like as soon as he said that, I'm like, oh my goodness. Of course that. And then it totally makes sense. And I'm like, oh, and your techniques are different, but it's those things then that I'm like, oh my gosh, this makes sense. Of course this would happen. And it's just so cool that there's like science backed up to everything that you guys do.
100%. Yeah.
I absolutely love that. And so again, if you guys, if you're out there and you're in any form of pain and you just feel hopeless, because I know that's how I felt. I just felt like there was no other options for me other than a surgery that scared me to death because the success rates were so low. Whether it's in your back or your elbow or your knees or your leg, whatever that is, I want to encourage you that a lot of our patients come here because they haven't found the right doctor. They haven't found, anybody that was able to help them. So I just want to encourage you that what we do here, it's so nice. You guys do 2 appointments. And I get this question all the time, so just want to address it now. We have 2 appointments. The first appointment is an exam. It's 45 minutes long, and it's really where you get to talk to your doctor one-on-one, expressing what you're going through, what you're hoping they're going to help you through. And then they do a series of what's called muscle testing. And the nicest thing about that, I know if you've never been here, you're like, what is that? the coolest thing is that while I'm here on Wednesdays with one doctor, the other doctor is actually out in our foyer right now teaching a class that explains exactly what muscle testing is. They do demonstrations, and that class is a free class.
Yeah, and it's going to be interesting because there you'll learn. So there's really basic muscle testing, and a lot of it is really absolutely no good. This is very specific neurologically testing muscles that are wired to different organs, and it's kind of like giving us a window into how the body works. So we use that along with other common proven diagnostic tools and techniques. It's one of the things that we use is muscle testing. It's not the end all be all. And then we figure out what's going on. And then you'd come back for the report, and during that time we'd explain exactly what we found, answer all your questions, talk about costs, everything like that. And if you feel it's right for you, then we'd get started with our first treatment immediately after that.
Or if you think you can help them.
Yes, and that's one thing too. It's a good point. We don't accept everyone as a patient. If we feel that we can't help you, we're not going to waste your time or money. One, because we'd be wasting your time and money, and two, I want to maintain a good reputation because I want to help the people that I can help and bring in more people that we can help and relieve their suffering. So anyone that we can't help, we're not going to accept. I wish we could help everyone, but I'm not that good.
And he means it too. I mean, I've sent people here that you have turned away.
Yeah.
And I'm so wild at that. I absolutely love that. And so I just want to encourage you guys, if you want more information, you can visit the website. It's www.ihwcenter.com. And you can always call me at the front desk, 724-205-6260. And then next week I get to be with Dr. Sarah right here, and we're actually going to talk about some female issues like PCOS. All right.
Nice.
Thanks so much for joining us, guys.
All right, guys.
Bye.
See ya.